Today's episode of the StallSide podcast was brought to you by Rood Riddle Veterinary Pharmacy. Today on the StallSide podcast, I'm joined by Dr. Claudia Ferreira, who is part of our internal medicine team at Rood Riddle Equine Hospital. She's recently joined us, and she will be talking today about pigeon fever, which has had a resurgence on the Bluegrass. So without further delay, we'll bring in Claudia. Okay, Claudia, welcome to the show.
Thanks. It's great to be here.
Yeah, thank you for taking time out of your day and being here with us. And welcome to Rood Riddle. We're so happy to have you here. Why don't you tell us a little bit about yourself?
Yeah, thanks. So actually, I was a Rood Riddle intern back in 2020. So I was a COVID year.
Yeah.
I went ahead from there and did my residency in internal medicine up in Michigan State. And then following Michigan State, I actually returned back home to California and was working in field service at UC Davis. So the grand return to California kind of introduced, I think, my colleagues and a lot of the vets in the area to potentially the pigeon fever and being claimed or pronounced as what I like to call the pseudo expert. I by no means am an expert of pigeon fever, and I certainly didn't bring it from California either. But I do.
It does seem that it came with you.
Yeah, it did. The timing was a little suspicious.
So before we jump into that, though, tell me a little bit about your background, why you became interested in becoming a veterinarian, and specifically with horses.
Yeah, so actually I think that my story is probably similar to a lot of veterinarians. Knew since I was a little girl that I wanted to be a vet, specifically with horses, because I had a lot of really great role models, particularly in college, and specifically Dr. Sprayberry, who actually had a lot of influence here in Kentucky back in her heyday as well. Yeah. So,
okay. That's fabulous. So did you grow up with horses then? Did you? Yeah,
I had one horse growing up. I did one of those $1 geriatric horses that, of course, cost way more than $1. And, from there it snowballed and became an obsession and now a career.
Okay, great. Well, you brought it up, the pigeon fever that we've been seeing here in Kentucky, and that's a little bit new to us. In fact, some of our veterinarians, when they started seeing it, were like, what the heck is this? And people started talking, and that one person's got a couple cases, somebody's got another couple cases, and so it's kind of opportune time for you to be here with us because this is not new to you.
Yeah, certainly. And being involved in a lot of the conversations and discussions about it, it was a little. Like being back at home, because certainly that was our bread and butter. And especially in field service, we were seeing a lot of pigeon fever. And kind of I would like to call this the reintroduction, because this is certainly not something new here in the area. Certainly if you look back at case reports and publications, they have retrospective cases where we have seen this in Kentucky. So I think that the resurgence is maybe just causing a little bit more panic, but it's been here before and it's more than likely going to stay. Yeah,
and certainly throughout my career, I've seen cases, but probably not quite as many concentrated like we have now. There seems to be quite a few. So what is it? I mean, we're used to seeing we talk. Well, I'll let you take over. But what is pigeon fever? Yeah,
pigeon fever, and it's a cute little term that was coined basically because the presentation is very reminiscent of a full-breasted pigeon, right? So pigeon fever is actually termed Corynebacterium pseudotuberculosis, but it causes more than often these basic external abscesses, and probably the predominant location that they manifest are going to be right there on the pectorals of the horse. So again, that's how it got that coined term, pigeon fever, because they made them look like little pigeons. But that's not the only location. Obviously, they can get them on their underbelly. They can get them up in the groin area. But I would say probably over 90% of them are going to manifest as these external abscesses.
Okay. So life-threatening, or, I mean, is this something that kind of comes and goes?
Yeah.
Should owners be worried about this?
Yeah, great question. I would say that over 99% of the horses that get pigeon fever and they manifest as these external abscesses, meaning these big pockets of pus on their body that are able to basically be drained, those are going to have the best prognosis. And with proper treatment and, attention, medical attention, they go on to be happy horses again. So definitely something to seek medical attention, like call your veterinarian out, because the best prognosis is always going to be those cases that see the veterinarian earlier rather than later. So that would be my kind of advice to owners.
So where are they getting these? Where are they getting the disease from?
Yeah, so this is a bacteria, like we kind of alluded to earlier. So it's caused by very specifically like this gram-positive bacteria. It lives in the soil and it's pretty hardy. So it's going to, it's not going to be inactivated or killed in direct sunlight. And it lives in soil for a good portion of time. So the main location or area that they are kind of manifesting or repopulating in the soil are going to be directly from these abscesses. So that draining pus is just a huge load of bacteria. It's just kind of this petri dish, if you will. So the biggest kind of concern I would say with treating these is when we lance or pop these abscesses, it can be super satisfying to relieve that discomfort for the horse and quote unquote kind of fix that problem. But we can't just leave all of that pus material on the ground. That's going to be a direct mode of transmission from horse to horse. And it's carried by not just us, but flies are going to be the predominant one that are going to be actually picking up that material on their legs and then bringing it to the next horse.
So did you see it in farms that were endemic for it then? Is it like same farms get it over and over again, or?
Oh yeah. So once this is in the soil, it's ubiquitous. So it's a really hard thing to eliminate, next to impossible, I would say. So once it's in the soil and one horse gets it, I would say, obviously do your due diligence and try to minimize the exposure to other horses, but I would say that it's basically on that property and likely going to be on the property next door. So that's going to be something that I think it's a hard pill to swallow, but one that I think will hopefully minimize some of the panic involved with this.
Okay, well, we'll continue with management and just saying, do you have any photos of this? You talked about what these look like and where we're getting them from. Yeah,
so, and again, I alluded to the predominant manifestation of this disease causing external abscesses. So right here I have some of the most common locations that I chatted a little bit about. So the pectoral region, giving this kind of pigeon-like appearance, and this one is actively draining, as you can see, but not all of them are actually going to be this nice kind of already draining abscess. A lot of them present with just a hard swollen mass, and many of the horses that get those swollen masses are sometimes present as lame, actually. So that is something to kind of always be on the lookout. They may not present nicely as a pigeon fever. They may actually present as a lameness. And then here's one that's on the ventrum or the underside of the horse. That's probably next common after the actual pectoral region. And then, of course, there's going to be some in the groin. And this is I've had one that actually was up there in a mammary gland, but certainly up there in the prepuce area for the males as well. So those would be the predominant sites for the external abscesses. And again, this is going to be probably how over 90% of the horses present, and they have a really good prognosis for return to a happy, healthy life after following treatment.
Okay, so that's interesting, and those remind me a lot of like Strangle's abscesses that we see. How is this disease different from Strangle's? Do you need to worry about it as much as you do something like that?
Yeah, that's a great question, and I would say it acts similarly in that pus material is contagious, just like Strangle's. But I put this lower on my list of things to quote unquote panic about. So biosecurity wise, strangles is not necessarily endemic on most farms. Whereas pigeon fever, that lives in the soil, it's impossible to get rid of. So now this is endemic, and there's some level of this is going to stay here. But on top of that, our prognosis for pigeon fever, when it comes to these external abscesses in particular, has a great prognosis. They're easier to treat. They're not requiring, advanced diagnostics like strangles cases are going to, because we're not needing a scope. We're not needing, strenuous or daily maintenance of this by lavaging. And these cases, I think, on a biosecurity management, once we get these drained and all of the pus material out of there and, do our due diligence on insect repellent, these guys are not really contagious. So I don't put these on such a high biosecurity risk management as I do the strangles.
Okay, gotcha. So if they're mostly picking up in the soil, but you say they can direct contact with the exudate from the pus, that you can pass it to another horse then.
Correct. Yeah. And so that's why we just want to make sure that when we're actually lancing these, as great as that is for the horse, and a lot of veterinarians, that's one of their favorite things to do.
You know what? It's funny. It's especially female veterinarians. For some reason, they love opening abscesses. They get excited about it.
I will say that is one of the primary reasons I became a vet. That's my favorite procedure.
Oh, that's awesome.
Yeah. So once you're done with that, as fun of a procedure as that can be for some vets, just making sure that we're really cleaning up after all of that, not leaving that in a garbage can that flies are going to be, populating.
Okay, so if it's living in the soil, is it weather related? Is it like the hot, dusty summers? Is that when we're mostly going to see these cases? Yeah,
and so there have been some publications on, some retrospective studies, like I was alluding to earlier. They have found that this happens, this fluctuates, with all the seasons. So it's not like we're going to evade this in one season, but they have seen a little bit of an increase, a tick upwards in the hot, kind of dustier time periods, and especially after following a rainy season. So maybe an especially rainy winter or maybe spring. And that might have more to do with kind of the insect population kind of ticking upwards. Gotcha.
Well, you mentioned that the external abscesses make up 90% of the cases. Where are the rest of them?
Yeah. So, and external abscesses, love these. These are easy to treat, great prognosis. There's two other categories that actually are sometimes a little bit more tricky to both diagnose and treat. So internal abscesses would probably make up the second, greatest population or predilection for these abscesses. And so those ones can be tricky to both diagnose and treat, like I said. And then following that, the more rare, I have actually personally not seen one of these cases, but one of the lymphangitis cases, and more specifically ulcerative lymphangitis.
And I think you have some pictures of both of those, don't you?
Yeah. So for internal abscesses, and these are, again, tricky to treat, and this came out of a publication related to both diagnosing and treating some of these. So this was in a liver as well as a kidney. And so these are going to be the cases that sometimes are going to present as a fever of unknown origin, or potentially even just an ADR. And this is going to be when advanced diagnostics and some of our more maybe unfamiliar blood work tests are going to come into play and be really crucial for filling in the puzzle pieces, so to speak. So ultrasound on these ones, and then very specifically doing something called a SHE test or titer. And so that is going to be testing the IgG related to basically one of the exotoxins that this bacteria releases. Okay. So those are going to be crucial pieces in our kind of putting this puzzle together and trying to diagnose the internal abscess.
Okay. Because I had a horse that I'm remotely associated with that I heard that it grew pigeon fever in its lungs. Is that a thing?
Oh yeah. So the internal abscesses, they like to be in a lot of the major organs. So we're talking liver, spleen, the kidneys. They can even be deep within the abdomen. And those are the ones where if we're not able to ultrasound it and potentially, with ultrasound assistance, aspirate those ones, then really what we're relying on is that she titer, because, ultrasound is only going to give us a superficial look into the abdomen. So these ones can really hide, but they can go basically anywhere your imagination takes you.
Yeah. So much more dangerous with these abscesses then.
Yeah. So these ones, and again, this is all going to be based on retrospective cases. They have 100% fatality if left untreated. That being said, if we do aggressive management of these, probably 30 to 40% have a good prognosis.
Okay. So you're less than 50-50 if you get an internal abscess.
Yeah. So it's a much different story compared to our external abscesses.
So are antibiotics effective against it?
Yeah. So this is like we chatted about in the very beginning. This is gram-positive. So these ones are going to really take to like our K-pen. Basically, our beta-lactam group is great against these. That being said, if we're handling this in the field, something like giving them minocycline or doxycycline that has pretty good penetration. The antibiotic that I would stray from or kind of avoid entirely that is a little bit, I would say, I always love to give SMZs. It's just something that, most people can afford and, readily available.
Oral, it's easy.
Oral,
cheap.
yes, totally. That is going to be something that cannot penetrate these abscesses.
Okay.
So that's going to be the one that I would really stray from. And unfortunately, this is long-term antibiotics. We're not giving this for a week and seeing, how it goes. This is at least 4 to 6 weeks. So we're hitting this really hard to try to get the best outcome possible.
Yep. Does it, do you ever get bony involvement with these?
I have not. I have not yet, but I'm sure that would be a possibility.
Gotcha. And so you talk about diagnosis of diagnostics in the internal abscess. How important is it to get a firm diagnosis on your external abscesses?
So the external abscesses, I would say, first of all, we chatted a little bit about doing the she titer. I do not do she titers for the external abscesses because if you think of it, they're going to have a high she titer, and we already see that. I still think that it is important because, one, if they have external abscesses, they still could possibly have internal abscesses. And how I diagnose them if they have an internal or external abscess would be gold standard is getting that culture. If we culture that, that's going to be giving us, one, a definitive diagnosis of Corynebacterium, but also two, it gives us the chance to make sure that whatever drugs we select are actually going to work if we couple that with the sensitivity. But I would say if I were to put in my, category of priorities, I think that it's going to be the priority to diagnose the internal abscesses. Yeah,
I got you. But it's a little hard to grow in the lab, I understand.
It can be. I have not had problems with it, but that's okay. What maybe a couple of our colleagues were sharing about the local labs here.
Yeah. Okay. Well, that's all very interesting. What else do we need to know about pigeon fever?
Yeah, so we covered a lot of it. Testing is going to be really important. Again, for these fever of unknown origins, I think that it's been pretty routine, at least in California from my experience, to do both an SEM, which is testing for strangles, but also doing the she titer. Okay. I think that there is a lot of knowledge to gain by starting to put that on our routine list of to-dos for our FUOs or a fever of unknown origins. Yep. Just because I wonder if if there is a little bit more pigeon fever out here, then we're able to report because we're not testing for it. So I think that that would be really valuable information just to, one, kind of start charting, how many cases we're actually seeing. And two, this is the sooner we treat these horses that potentially have the internal abscesses, or, the ulcerative lymphangitis cases, the better prognosis we have. So I think that diagnosing these sooner and running the appropriate tests is going to be invaluable.
Yeah. Well, I do hope you're wrong. I hope this is just something, this is just a blip in the radar and it goes away, but it sounds like it's something that we're going to have to keep an eye on and keep watching.
Yeah, potentially. And again, I did not bring this from California. It's been here just based on some of the previous publications. But yeah, I do agree that it would be nice if this is just a blip and we kind of carry on from here without any more complications.
I think it is. Hey, something I wanted to talk to you about that you kind of alluded in the in your introduction. You're a biker, right?
I am, yeah. So I do race professionally.
You do?
Yeah.
All right. So what's on the horizon for you with that?
So I do have, I'm on an amazing team that's actually based in California. It's called Monarch. I'm not sure if you're familiar with women's cycling, but that's the best team.
Okay.
I'm unbiased there, obviously, but we'll be racing a lot of races here in the country, and we'll be actually heading over to Ireland come next September. So we'll be racing internationally, yeah.
So what distance do you...
So a lot of them are actually various distances. So we do stage races. So we do 4 to potentially 6 days of racing. And a lot of it is going to be somewhere between 40 to 80 miles each day. Normally there's 1 or 2 days where we do an all-out 10-mile, or we do criterium racing, which is basically, I always compare that to NASCARs for bikes. Go around in a tight circle, try not to crash out or get crashed out. And then, whoever...
Do you wear those really cool long helmets?
Oh yeah, the time trial helmets. Yeah. That's going to be for the all out 10-mile. And that is my specialty.
Is it really?
Yeah, it is.
Okay. That's pretty cool.
Yeah.
All right. You were hiding that from us just a little bit. All right. So, how are you enjoying your time at Rood Riddle?
Oh, I love it. This is possibly the best place to work.
I agree.
Again, unbiased, but it's been great so far. Everyone's been super welcoming. The Pigeon Fever talk was the first thing that was on my radar, which I was happy to kind of help out with. But I'm looking forward to a really busy foaling season. I know that's maybe not what everyone wants to hear so far, but I do really love working with the foals. So.
Okay, that's great. Well, we're thrilled to have you here, and thanks for taking time with us to talk today about pigeon fever.
Yeah, thank you.
I don't want everybody to think that that's your specialty, but it's it's a part of it and some expertise that you have that you can bring to us. So
yeah,
thank you very much.
Always happy to help.
All right. Well, thank you for joining us on StallSide today. We've been with Dr. Claudia Ferreira speaking about pigeon fever. See you next time.